Hi everyone, a very good evening to all of you. My name is Ashna Sisodia and you are watching this video on Unacademy's YouTube channel UPSC Articulate. Today we are going to talk about the news that recently third patient has been cured of HIV. There's a 53-year-old German man. He's the third person to be cured of HIV after going through a bone marrow transplant from an HIV resistant donor. This report was published in the journal Nature Medicine. They have released about a patient being cured of AIDS. The transplant was performed for blood cancer treatment, and the HIV virus was undetectable in his body even 4 years after he stopped taking antiretroviral medicine. The patient received a stem cell transplant from a female donor with a rare mutation in her CCR5 gene. This gene, which has stopped HIV from entering cells. The bone marrow transplant used in this case is a severe and dangerous operation, and it is only suitable for some special cases or a small number of patients suffering from HIV and blood cancer. And according to the study, this case of HIV-1 cure, it provides valuable insights that will hopefully guide future cure strategies. So what is this CCR5 gene mutation? Let's talk about that. This is known as CCR5 delta 32 mutation, and this is found in 1% of the population. It prevents the CCR5 receptors on CD4 immune cells. These are the immune cells, and this acts as a doorway for the HIV virus from forming on the surface. People with two copies of the mutation are almost immune to HIV, while those with one copy are less likely to contract the virus. Now the question is, can bone marrow transplants solve the HIV crisis? Well, this mutation occurs mainly among Caucasians, which makes it quite difficult to find a matching donor, especially for those from countries with high HIV burden. And bone marrow transplants, they are very risky. It's a complex procedure, and this is unlikely to be rolled out for all those with HIV. A bone marrow transplant is basically a medical treatment which replaces one's bone marrow with healthy cells. The replacement cells can either come from the person's own body or from a donor. And a bone marrow transplant is sometimes also called as a stem cell transplant, or more specifically, we can call it as a hematopoietic stem cell transplant. Now, what are stem cells? Stem cells are undifferentiated, or we can call them as blank cells, which means they are capable of developing into cells that serve numerous functions in different parts of the body. Stem cells can divide over and over again to produce new cells, and as they divide, they can change into the other types of cells that make up the body. There are mainly two types of stem cells. One is embryonic stem cells and adult stem cells. Now, another good thing about this is that at least this is going to give us a valuable insight that is going to hopefully guide future cure strategies. Now, regarding this mutation, in layman language, if I have to say, this CCR5, this delta 32 mutation is a genetic variation which makes some people resistant or less susceptible to certain strains of the human immunodeficiency virus, which causes acute immunodeficiency syndrome. And this mutation, it affects a protein which is called as chemokine receptor. And this protein, which HIV uses to enter and infect the cells in the immune system. So this mutation, it results in a non-functional CCR5 receptor protein that cannot be used by certain strains of HIV. Now, this bone marrow transplants, they have been used in some cases, but they are not a practical solution, to be honest, for the HIV epidemic as a whole. Bone marrow transplants, as I told you, they are very risky and complex medical procedure. It involves replacing the patient's own bone marrow with donor stem cells that are resistant to HIV. And this procedure is not widely available. It is reserved for very specific cases. Bone marrow transplants are not a cure for HIV, and they do not eliminate the virus from the body. While the donor stem cells may be resistant to HIV, there are other cells in the body that can still be infected with the virus. As a result, individuals who have undergone a bone marrow transplant still need to take antiretroviral therapy to suppress the virus and prevent HIV-related complications. So these are very expensive, and the procedure carries significant risk, including the infections, rejection of the donor stem cells, and even death. Given these factors, bone marrow transplants are not a viable solution for this crisis. Now, what is AIDS? AIDS, it stands for Acquired Immunodeficiency Syndrome, which is a chronic, potentially fatal condition caused by the human immunodeficiency virus, that is HIV. What are the causes of AIDS? It's a virus which attacks the immune system, specifically the CD4 cells. These cells are crucial for fighting off infections. So this primarily spread through unprotected sexual contact, sharing needles or syringes, and from mother to child during pregnancy, childbirth, or even breastfeeding. Now, what are the symptoms of AIDS? Well, this includes actually those who are suffering from this HIV, they do not experience any symptoms for years after infection, but the virus continues to damage the immune system. And as HIV progresses, symptoms like fever, like fatigue, weight loss, night sweats, swollen lymph nodes, and recurrent infections. These are some of the symptoms. Now, what about the treatment? Well, at present, there is currently no cure for HIV or AIDS, but antiretroviral therapy, it can slow the progression of the virus, and this can improve quality of life. It involves taking a combination of medications that target different stages of the virus life cycle, reducing its ability to replicate and damage the immune system. The drugs have to be taken for life because the virus continues to persist in reservoirs across the body. And if this is left untreated, the virus, it destroys a person's immune system and leads to AIDS, resulting in death. There are various types of HIV treatments, which include stem cell based gene therapy, broadly neutralizing antibodies, and latency reversal. Some of the important facts and figures related to HIV includes there is an AIDS Society of India. India has the third highest HIV burden with 2.35 million people suffering from this. And in 2019, there were 69,220 new HIV infections and 58,000 AIDS-related deaths in India have been registered. The UN AIDS report of 2020 shows that Asia Pacific region saw a 12% decline in new HIV infections and a 29% decline in AIDS-related deaths over the last decade. Now, what are the government steps to control this? India has implemented various schemes and programs to control and eradicate AIDS in the country, which includes National AIDS Control Program. Now, this is a comprehensive program which was launched in 1992 to control the spread of HIV AIDS in India by promoting safe behavior, increasing awareness, and providing counseling and testing services. Then we have targeted interventions. It's a program that targets high risk groups such as sex workers, injecting drug users, and men who have sex with men. And then we have antiretroviral therapy. Actually, the government provides free antiretroviral therapy to all HIV positive patients in the country, besides providing free diagnostic tests. Then there is a 90s to 90s to 90 strategy, which is adopted by UNAIDS, where 90% to diagnosed and treatment by antiretroviral treatment therapy and suppression by 2020. This has been extended by 10 years. Now the goal is 95 is to 95 is to 95. Then we have community based approaches. Jan Jagriti Abhiyan is there, which is a mass awareness campaign launched by the government to educate people about HIV and AIDS in rural areas. And we have National Rural Health Mission. It was launched by the government to provide primary healthcare services to people living in rural areas. But did you know Timothy Ray Brown, the Berlin patient, was the first person to overcome HIV after receiving 2 stem cell transplants in 2007 and 2008? The donor actually carried 2 copies of CCR5 delta 32 genetic mutation. Then there is a London patient, Adam Kistlow, as also he underwent a transplant from an HIV resistant donor for blood cancer treatment, and the virus remained undetectable in his body after the transplant. So while bone marrow transplants offer a cure for HIV, they are not a viable option for everyone. Antiretroviral therapy remains to this date the most effective treatment for managing HIV and preventing the transmission of the virus. This is it for this session, guys. Thank you very much. If you're planning to take subscription of Unacademy, you may use my code Ashna Sasodia. You'll get great discounts on your subscription. This is it. Thank you very much. Bye bye. Good night.